Good morning, everyone. My name is Raj Agrawal. I'm the Vice President for Clinical Development and Ophthalmology Lead at Rezolute. At the outset, let me thank the co-chairs of OIS Retina Summit 2022, Firas, Caroline, and John, for this opportunity for me to present our work. I would also like to thank the co-chairs, as well as Craig and Maureen, for making this video presentation possible. I apologize for not being there in person for this meeting. I'll be speaking to you about RZ402, which is an oral plasma kallikrein inhibitor being developed for treatment of diabetic macular edema. Rezolute is a publicly traded company, and during this presentation, I may be making some forward-looking statements. For patients with DME and for AMD also, anti-VEGF injections are now considered standard of care, but a significant proportion of these treated patients do not demonstrate adequate response. In addition, we also see a treatment burden on patients and also on physicians, which sometimes leads to undertreatment. Patients tend to skip injections, and this compliance issue can also potentially lead to undertreatment as well. Injections are required to be given in a clinical setting, which requires patients to come to the clinic every time. In addition, when we look at real-world data, when we compare that with data from randomized controlled clinical studies, we notice that patients tend to receive less injections and exhibit worse visual outcomes in the real world compared to what we see in controlled clinical studies. RZ402 targets a different pathway, addressing inflammation and vascular leakage. It has been shown to significantly inhibit kallikrein activation in human plasma, with a significant suppression of vascular leakage in animal models. It is likely to be a treatment alternative to patients who demonstrate suboptimal response to anti-VEGF injections. Oral delivery provides some advantages to patients, with comfort and convenience being the most important. This may be a monotherapy drug by itself, or it could be a combination treatment with anti-VEGF injections or with some new drugs in development at this point of time. An important aspect of this drug is the possible preventative effects in patients with DME and DR, possibly opening up a new door to how we manage patients with these diseases. Kallikrein-kinin system is strongly implicated in DME and DR. In patients, plasma markers were found to be elevated by almost 50%, while vitreous levels were elevated 11-folds in these patients. In preclinical models, injection of kallikrein led to DME-like features, which was rescued by bradykinin antagonist, but not by anti-VEGF injections, while systemic RZ402 was able to reduce these DME-like features in these animals. In this particular slide, preclinical data demonstrates both the treatment aspect after onset of DME on the left in regards to RZ402, and prevention of DME with RZ402 on the right, suggesting the possibility of RZ402 being given to patients earlier than the way we provide treatments to patients at this point, and possibly even to prevent the disease to start. Based on positive preclinical data, we moved to 2 phase 1 studies to evaluate safety of RZ402 in adult healthy subjects. 2 studies have been completed, with the first one being the single ascending dose study, the outcomes of which were presented at OIS Summit last year. We recently completed multiple ascending dose study with 4 sequential drug cohorts of 10 subjects each at 25 milligrams, 100, 250, and 500 milligram dosage, which was given once daily to subjects for 14 days. The primary objectives were to assess safety and tolerability of the once daily oral administration of RZ402, as well as to determine its PK profile, while also exploring biomarkers of target engagement and related PD effects. In terms of safety, there were no adverse drug reactions noticed in this study, no SAEs, and no study discontinuations in the multiple ascending dose study. 19 subjects in the treatment arm had a total of 48 AEs compared to 5 subjects, or about 63% in the placebo group. There were few gastrointestinal related AEs reported in these subjects, with nausea, diarrhea, which were found to be the routine AEs noted. All AEs were mild, grade 1, and were not found to be dose dependent. There were no systemic effects such as blood pressure or heart rate issues, while ocular exams and lab evaluations were unremarkable. In the PK evaluation part of the study, dose-dependent increase in systemic exposures was found, with drug accumulation being less than twofold. The 24-hour levels and half-life of this drug supported a once daily oral dosing of this drug for patients. Steady state was achieved within 48 to 72 hours, while the safety profile had a large safety margin compared to animal toxicology doses and exposures. The cohorts 3 and 4, which is the higher side of dosing, 250 milligrams and 500 milligrams, demonstrated higher inhibition of plasma kallikrein activation, while mean inhibition was statistically significant in higher doses. There was also a good linear relationship between mean percentage inhibition and mean plasma concentrations. In conclusion, RZ402 was found to be safe and well tolerated across all doses without dose-limiting toxicities. It also showed adequate bioavailability with dose-dependent increase in systemic exposures. Results at both peak and 24-hour trough exceeds target concentrations based on profiling. We plan to initiate a phase 2A proof of concept study later this year. Thank you so much.